Hello again, everyone. I wanted to make sure I got to this presentation and get this out there. These are my thoughts. Um, some of the things I reflected on in my experiences with approaching different individuals with gender dysphoria, who are transgender, who are intersex, who are any and all of the above, even working with those who are anywhere on the LGBTQ spectrum. Um, because everyone's experience is completely different from everyone else's, I try to keep these as general concepts overall and not necessarily specific recommendations. Think of this as overall ideas. And this can be approached from parents, guardians, individuals. I really wanted to kind of give this as a broad overview of how we interact with each other. And I mean, is this a lot of the golden rule sort of idea? Well, sure, but I want this to reflect us individually and also give things like some goal-oriented ideas, um, and see if that helps. I would love for some feedback on this one and how I can expand on this and evolve this over time. But again, these are several of my thoughts, and hopefully these are helpful to you. As we go into the first slide in this overview, um, I've talked a lot. I've had several videos of recognizing gender dysphoria as a diverse set of associations and to approach people individually. One person's experience with gender dysphoria is separate from a different, and the association or contributory cause is different from one person to another. So being able to distinguish between one versus the other and saying this is the absolute best way to go about doing this is very difficult to manage. I get this question a lot in medicine, and patients who are nearing the end of their life. I get asked this question all the time by family members about how long it's going to take. And that is probably one of the most difficult questions in medicine for any physician. Even with years of experience under my belt, I I've been surprised. I've had patients pass away within a few hours after I say that they can last for 4 to 6 months, or say they um, last for a short period of time, and it's so variable. And that's kind of the same idea here, is that this is such a diverse set of individuals that it's hard to pinpoint any one thing that's going to be helpful. So here, these are basically just ideas. I've talked about in the previous video about understanding that gender dysphoria is a relationship between mind and body, that those connections are making things difficult. Emotions are difficult to work with. And as a consequence of that, this is where gender dysphoria presents itself as a incongruence, this distress, which is hard to describe for a lot of people because they may or may not have the language to be able to do that. The next thing I usually recommend with people is help support the person. And this can be done in different ways. They are, as I imagine somebody coming to a trusted individual, or they have gathered enough strength to be able to express this is part of their journey, and sharing that with another person is a huge leap of faith in that other person and their expectation of how the other person is going to respond is vital to how they're going to do going forward. Some of these times when we come to a parent or a loved one or a guardian or a teacher and say, hey, I have gender dysphoria, I feel like I'm a boy, or I feel like I'm a girl, there is that relationship of trust, or they're pushing themselves to express themselves to another person. And when that's done with that person, it's a lot of pressure on that other person and to try to get it right. So in the past, as we have done this in the past, sometimes those responses have been not so great. And as a consequence, people who are told that their loved one has gender dysphoria will shut them off, or cut off relationships, cut off ties, make it more difficult for the person, not respect the person, not be helpful, not use pronouns, not use preferred name. Um, I actually had a thought with this. I have a child whose his name is Elizabeth, but we've always called her Lizzie, and it's her preferred name. It's a nickname, but we use it all the time. And it's kind of the same idea with these individuals. They have a preferred name. Could you approach it from the idea of, is it a nickname? Sure. If that helps you support this person better, that is certainly one approach to do it. Is there a point where some people actually ask for their name to be changed? Yes. And that is something that you have to be able to respect the individual for their autonomy and that they are who they are. I encourage reflection and self-acceptance. This one's a hard one for people with gender dysphoria, that self-acceptance part. Because we're taught from a young age that, or maybe our culture and society is teaching us that we shouldn't accept this part of ourselves, that we're wrong, or that this is something that needs to be shunned or pushed away. And part of that self-acceptance is reflection. And that can be done in different ways, whether it be meditation, prayer, even yoga, or things like that. But it's that reflection on ourselves, that where am I at? Taking in that moment, taking in that living in the now, and understanding that there are things that we can control and cannot control, and learning and understanding that we can have influence on the things we can control, but not necessarily all things. Fostering relationships, understanding that this is not a journey that we need to be taking alone. We as humans are very social creatures. Um, we do this all the time, especially at meal times. This is a time to foster relationships, familiar relationships, and we interact with one another. We engage in activities and conversation, and doing it in such a way that is uplifting to each other and caring for each other is a wonderful thing to do. So stretching ourselves and pushing out beyond ourselves to interact with those who are seemingly different than ourselves. And when we go back to the very first point up there, talking about it as an individual, that we all have individuality, that we're all different. No matter what we do, we're always going to be experiencing with people who are different than ourselves, and kind of stretching and broadening ourselves into things that we may or may not feel comfortable with all the time is just part of our human experience. Symptoms of gender dysphoria can evolve. And I think that's really another thing that's important with this, is it doesn't always stay the same. As we grow, as we learn to interact with ourselves and others around the world and interact with society, our understanding expands, our cells expand. It's a learning process. It is important to involve appropriate medical and psychiatric care. As humans, as parents and children and individuals, we don't know everything. I was actually talking to another person today that even though I'm a physician, I'm a doctor, there are definitely things I don't know, but I certainly am willing to seek out those answers and try to get the best information I can. So as parents, we don't have all the answers. We don't have the training that a physician has, or a nurse has, or a psychiatrist, or a psychologist, or any of these other specialties. And they can come with the tools to help these individuals give themselves the ability to communicate and talk about their experiences, and also give the parents or guardians the ability to interact appropriately or help this individual through their personal journey. So as I was thinking about this, when I reflected back on my experience, one of the things that I learned is recognize. Recognize that there's these feelings that do exist, that gender dysphoria does exist, and it's not something to be ashamed of. I did recognize early on in my life that I had gender dysphoria. I couldn't explain it at that point in time. And even back in that era in the 80s, we didn't really know what to do with it. There was experiences of people being sent off to conversion therapy or being ignored or running away or things like that. And so I recognized it, but I didn't know what to do with it. And I failed to get into that next part of acknowledging that they were there. I wanted to get rid of them. Recognizing that they are there and that they're not to be ashamed of, that they are part of who we are. And I didn't work on this next part. I did other things that would have, I tried to get rid of them, but working to identify those feelings and translate them into language that you as an individual can understand, or helping other people understand so that they can help you better. This can be done in different ways. One of the things that I found very helpful for me was writing. Drawing is another method of communication, even in things that we don't necessarily think of as language. If expressions, facial expressions, dance, um, music are all other forms of being able to express ourselves in languages that we can understand. What is the language that you as a person is experiencing these feelings? How do you take those feelings and emotions and understand them? Acknowledging that they could be gender dysphoria. It could be an evolution of something else. Maybe we need to recognize these emotions and work with them through different avenues and methods. Um, Writing them down, drawing them out, expressing them through music and dance is a way of doing that in a safe way. Identify that safe space. This could be an individual, this could be a location, this can be a forum, this could be a lot of different places that could be in the cloud, it could be virtual, it could be real, it could be another person, it could be a location, just a safe place that you can go to and say, here I am safe. I can be myself and acknowledge and go through emotions. Affirmation. So I went over recognize, acknowledge, affirmation. Not only do we have to acknowledge these emotions, these symptoms that we have, but we also need to have them affirmed. They are real. We are real. Your emotions are real. You are loved, even though that you may not see it directly at that moment in time or with interactions from around you. There are people around us are willing to love and reach out and care for one to another. You have importance. You have value. You have worth. And even though we think of value and worth as very similar concepts, value and worth, I think of worth as being able to provide more. Value is in the here and now. Worth is moving forward. You have strength. The very fact that you wake up from day to day and move and experience life means that you have strength within you. There is community around us. This is not just a one experience. Going back over here, there's relationships that we can foster, translating this into other people and helping them to understand us as we understand them is really actually a very key part of our humanity. So here comes the interesting parts where I have really thought hard about how I would try to approach these experiences. Gender dysphoria ebbs and flows. It can be frustrating. Just straight out of the gate, I'm just going to say it. Gender dysphoria is frustrating. Um, because it has so many different sources, it has so many associations, it's frustrating. Even from a medical provider, from a psychiatrist, from a psychologist, it's frustrating. So here are some things that I've noticed that can be helpful for other people. Try to decipher patterns. This can be on a weekly basis, can be a daily basis, this can be hourly basis. As we go through our lives, there are things that we need and there are things that we want. As we recognize those needs and those wants and working to decipher what we have control over and what we don't have control over, we can help recognize these patterns and work to have influence on them. We need to find out things that work and things that don't work and write them down. In my medical experience, one of the things that I do is as I walk into a patient's room, I ask, of course, if they have any questions. And it's not infrequent where they say, well, I had a question 10 minutes ago, but as soon as you walk in the room, they forget. Write them down. Write them down. And I encourage the patients to do that too. If you have a question, write it down. Because the old saying about the dullest pencil is better than the sharpest mind is very true. We're forgetful. We're human. This one I also really love. Allow emotions. We are human beings. This is part of who we are. We're allowed to have emotions. It's okay to be sad. It's okay to be happy. It's okay to be angry. It's okay to be frustrated. But what we have to be careful with is what we do with those emotions. It's okay to emote. It's okay to be real and in the present moment. But really what the goal is out of all of this is allow these emotions to happen. But what we want to do is end up in a better place when those emotions are complete. So even if we have a happy moment, take those happy moments and allow ourselves to put ourselves in a situation that's a better place. If we are sad, allow that emotion to take place. It's okay to cry. But at the end of that moment, find ourselves in a better place. Where is that? What is that? It is okay to reflect. As we go through these emotions, it's okay to look back at them and say, what did I do right? What did I do wrong? Learn from our experiences. And we can reflect, we can meditate, we can pray. But one of the important things is we need to recognize our spirituality as well, and that we are a whole, that we're mind, body, and spirit, and that exercising one aspect of our individuality helps encourage and strengthen the other aspects of our lives. So strengthening our mind, strengthening our body, strengthening our spirit, really this whole collection of effort to make ourselves better. It's okay to take time to process and time to feel. My experience is different than others. When I first came out to my wife in 2014, I wasn't sure where I was going to end up in the midst of all this. But I took my time because that is what I needed. The one thing I can strongly encourage, though, is don't rush decisions or judgments. Take your time to process them. Take your time to actually analyze and study them out so that when you are reflecting on these decisions, you can feel confident that you made the right decision in the midst of all this. You are not alone with what you experience. There is a lot of people out there that are in similar boats and circumstances, but your experiences are unique. And just like we talk about individuality, that everybody who has gender dysphoria is very individual, this is the same idea. Everybody has similar quote unquote experiences, but you as an individual have very unique experiences. That in of itself makes you a unicorn. You're cool, you're unique. That's cool. That's amazing. Being able to share that and do that in such a way that's helpful to you and others is really a learning experience in of itself. And be careful with comparing yourself to others. I think we do this rather frequently. I think a lot of people would love to have the billions of dollars as Warren Buffett or other one of these billionaires. But here we are with our set of circumstances and our set of challenges, and we're comparing it to Warren Buffett's strength of he has a lot of money. The timing of when things happen, when decisions happen, or when we open ourselves up to other individuals. There are times we reflect back and we wish that we would have done things sooner. We wish we could have done things differently. We wish that things could have been said differently, or the interactions we had with other people could have been done differently. We have to be careful with that and avoid comparing ourselves to other people in the midst of that. There are times where we need to listen to other people. Sit down, be quiet. And usually what I do with this analogy is in medicine, when I make a diagnosis and I start a treatment, sometimes I have to sit on my hands and say, I need to allow this treatment to take effect. The perfect classic example of that is somebody with a skin infection, let's say just on their leg. I started an antibiotic, and the classic textbook is that things look worse the next day before they start getting better. And allowing myself to sit on my hands and say, I don't need to change anything because even though it looks a little bit worse, I know the treatment is going to be effective. And that this is a typical pattern of this disease process. So at that same lesson, there are times when we just need to listen to other people's experience. We can chime in from time to time to ask appropriate questions, but the goal for that person right now, they need to be able to communicate and do so freely. There are times for that advice. It's not always. We need to be careful with giving out advice to other people. Along those same veins, there are times for self-care. There are some times where we can't simply do everything. And there's other times where we can care for others and serve as well. But we also need to take time for ourselves. Otherwise, we do burn out. I do encourage people to be able to explore, but be careful with what you explore. Explore the things that make you better. Explore the things that are going to make you uplift you and take you to that next step of I am a better person as a consequence of that. Not in comparison to other people, but a reflection of myself. I can walk away and say, I'm a better person because I am doing this. And just as importantly, what doesn't make us better? We need to reflect on the things that don't make us better and move away from those things. Replace them with things that do help us become better. Recognize that there are things that are in our control and that there are things that aren't. We do this a lot. I was born with a bleeding disorder. That is something that is out of my control. It is something that is genetically a part of myself. And if I don't take care of it, I bruise and bleed easily, and it causes a lot of significant pain. But the thing that I can control with this is making sure that I take my medication in a timely and appropriate manner. Or things that I can control myself for is making sure that I don't put myself in dangerous situations. I don't anticipate my entire life going skydiving or running with the bulls. I'm not going to participate in football because of that risk of bleeding and injury. Other people, that's part of who they are, and that's what they want to experience. They don't have that bleeding disorder, and that is something that they enjoy doing. It's okay to actually have those things that you can control, and it's okay to recognize that there's things that you don't have control over. This last one, avoid destination fever. It is really about the journey. Oftentimes I hear stories of people saying, by this time, by this date, by this age, I want this to be accomplished. Or when I turn X age, this is going to happen. And we put limits on ourselves. We put a focus on ourselves. And in my thought, that's a destination fever. We're looking at a goal, and don't get me wrong, goals are important, but we're forgetting the process in between. We're forgetting these other aspects of growth and learning. And we're focusing so much on that end result that we forget about the joys and happiness that we can have along the way. This takes practice. I'm going to go back up to this gender dysphoria ebbs and flows. It can be frustrating. This takes practice. There are bound to be errors. We're going to have some mistakes here every once in a while. It's okay. Learn from it, reflect on it, take another step forward. You don't have to take these journeys alone. So as you listen to this, I hope that in the end you walk away from this conversation feeling uplifted, that you are real, that you are loved, that you are cared for, you are an individual. For whatever reason that you are experiencing gender dysphoria, it's real, it's part of you. But there are things that we can do to help ourselves and to help others and have other people help us. And it's okay to do that. There are things that we can control, there's things that we can't control. If you do ever find yourself in a point of crisis, there are people that want to help you. We want you here. We want you here. I'm going to say it again. We want you here. There are many resources available to help. There's the 988 number, and that's in the United States and Canada. There's several websites that are available to anybody, really. And we're here to help. Reach out. We love you. We care for you. Thank you.